UBC, inspiring Uganda.
Hello viewers, welcome to the program Safelife. My name is Kathy Ishinu, and today we're generally going to be talking about oral health. I am with a specialist, Mr. Dr. Ntwatwa Lule, here in Bakuli and at Ntwani's Dental Clinic. You're most welcome to the show. Please say hello to the viewers.
Hello viewers, it's nice to be with you once again.
Well, how often should a person visit a doctor for a dental checkup?
Well, some people say every 6 months, but actually we can modify that a little bit. If you consider a very young child, say 3-4 years of age, the enamel and dentine are very soft, and if decay does start, it occurs very rapidly, and within a short time, it can reach the nerve of the tooth, causing a lot of pain. So for very young children, it's important to visit the dentist actually more often than 6 months, about every 4 months or so. That would be more ideal for very young children. And also people with a high caries rate. High caries rate meaning they are people who eat very sweet things, and decay will occur in them much faster. They would also be advised to visit the dentist even more regularly. They're very old and debilitated. Sometimes people who have suffered from stroke and are unable to clean their mouths regularly very well and efficiently, they would also be advised to visit the dentist on a more regular basis to make sure that the oral hygiene is up to scratch, and the dentist can also assist them to help the oral hygiene be maintained at the proper standard.
Well, you did talk about children. When should my child first have the first visit?
The first visit to the dentist should occur roughly at a time when the first teeth start to erupt. It's important for the child to visit the dentist early. For one, the child needs to start developing a relationship with the dentist. In most cases, you don't expect any treatment to be done. This first visit really is an introduction to the dentist. They need to get used to the person. They need to get used to the environment in which the dentist works. They need to get used to all the instruments. Well, maybe not all of them, but some of the instruments, the lights, and basically the environment the dentist works in, so that they are more comfortable. It's always a bit difficult when the child's first appointment, even if it's at the age of 6, is an emergency where treatment has to take place. Maybe they have fallen down and broken a tooth, or they have gone because of toothache, and they are in a totally foreign environment. It creates a lot of anxiety. And so it's always best to help the person develop a relationship with the dentist. And also, at that time, it's also a chance for the dentist to instill into the child good oral hygiene practices, so that they grow up knowing what's best for them.
Okay. Well, you did mention tooth decay. I'm pretty sure there must be someone out there who does not know what tooth decay means.
Tooth decay is actually an infection of the tooth by bacteria, and it basically causes holes in the teeth, and we term that a cavity in the tooth. One would recommend to brush at least twice in a day. Try to use gentle circular motions. Avoid a hard toothbrush, medium or soft toothbrush. Take enough time when you are brushing your teeth. Make sure you brush all the teeth and all the sides of all the teeth. Some people forget to brush the inside. So you try to balance 50-50, the insides of the teeth with the outsides, using gentle motions. Try not to be in a hurry. You may also decide to brush before the meal, and then after the meal, rinse or even gently brush. So brushing twice daily is good. If you can use dental floss as well every time after brushing, then it can also be an addition, because dental floss reaches those parts of the teeth, especially in between the teeth, where the toothbrush cannot reach. Try to watch your diet. Try to avoid sweet, sticky things, especially the ones in colorful packets in the supermarket. You need to avoid sweets, toffees, chewing gum with sugar, all the sweet things. If you're a parent who is giving your children snacks that they take to school, try to avoid the sugary ones, and more take to the salty ones rather than the sugary ones. Also, do remember that the natural foods are also good for one's health, especially for growing children. So all those things that are obtained in the market, fresh fruit and vegetable, is also good. Giving the child an apple or a carrot or a banana to take to school with them may be better than biscuits, and especially sugary ones.
In case sometimes it's unavoidable. In case that happens, and or parents always want to, like, today you give the child this, tomorrow you give them this. Even as you say, you like, okay, I'm having banana, then tomorrow you're tempted to have a chocolate, you're tempted to have biscuits. In case that happens.
In case that happens, it's always best to brush the teeth immediately afterwards. That may not always be easy in school if you don't take the toothbrush with you, but at least have a good rinse. Or maybe have the chocolate first and then have the carrot afterwards. So the carrot, the fibers can help to clean the teeth as it's been chewed. Also, to add to that, it's also good to have a regular dental checkup. Again, we said roughly every 6 months, but more often for young children, more often for the elderly and debilitated. It's always good to be your own dentist at first. So, have a look in your own mouth, check. Check for swelling, redness, painful spots, ulcers, bleeding gums. So anything that you feel that is not normal, try to, maybe if it's on the teeth, try to brush it off. If it's a persistent dark area, maybe get it checked by a professional.
Okay. Well, talking about the bleeding, the teeth bleed, the gum or maybe the teeth bleeding, is it normal for my gum to bleed when I brush? Let's say I'm not having, if I've like taken self-examination and I don't have any painful, I don't have anything at all, but then when I brush my teeth, my gum bleeds.
You do have something.
Then that means I do have something.
Yes, you can't have anything at all, and then when you brush your teeth, your gums bleed. If your gums bleed when you brush the teeth, you do have something.
What if it's a toothbrush?
If it's a toothbrush, that's very hard.
Maybe I'm using a lot of force, because people believe by using a lot of force while brushing your teeth, it's when they get cleaned.
And damaged.
Yeah, but what would you advise such a person who still have that same thinking of, if I use a hard toothbrush, it's when my teeth get cleaned, or it's when I...
Well, as we said before, brush regularly and brush gently.
Yeah.
The teeth and oral tissues are very delicate and should be handled very carefully. When you do excessive brushing, especially with a hard tooth, you will not only damage the gums, but you will damage the teeth as well. The gums are frequently damaged by excessive backwards and forward scrubbing. That leads to tooth recession. The gum rises up the teeth and exposes the roots. The roots are covered with dentine. And the dentine, being softer than enamel, will be preferentially worn away, causing a deep groove in the tooth. So when you pass your nail next to your gum, you find there's a little ledge. That's usually damaged by the toothbrush. And once dentine is exposed, it leads to sensitivity. So you may not be able to eat ice cream or drink very cold things, or even simple air passing across the teeth may also cause discomfort. So the teeth need to be gently cared for. And if you do use a soft brush and you gently brush the teeth and you find that the gums bleed, then the chances are the gums are inflamed. And the usual cause is deposits on the teeth in terms of plaque, which contains around 70% bacteria. The bacteria in the plaque metabolize the same foods that we eat. And after they use the foods, they produce byproducts which are toxic to the tissues of the gums. And that leads to the gums becoming inflamed, reddened, and they also bleed.
Okay, so what normally causes bad breath?
Bad breath is caused by a number of things. It is frequently you can have a problem inside the mouth. If you don't brush your teeth very well and you have like a poor gum disease, then pus coming from the teeth will continue even if you brush well. That can be a common cause. A cavity inside a tooth, that will also cause bad breath. But we need to remember the breath in general comes from the lungs. And as you breathe out, anywhere along the root where there is inflammation can also cause bad breath. So if you have a disease of the lung, like tuberculosis, you're basically having an infection in the lungs. The lungs will be infected and there's a war between the bacteria and the tissues, leading to death of some of the cells, and it will cause bad breath. So as the air comes out through the lungs and the bronchioles, you can have bronchitis, you can have laryngitis. Within the sinuses, you can have sinusitis. Into the mouth, you can have tooth decay, you can have gingivitis. So all those things can cause bad breath. Sometimes people who have stomach issues will also have bad breath. But frequently, if there is poor brushing, yes, you will also have bad breath. So there's a number of issues that cause bad breath, and it's important to distinguish between them. Sometimes one person may perceive themselves having bad breath when actually they don't have bad breath. So a professional will be able to point that out as well.
Okay. Well, taking you back a little bit, did you talk about tooth sensitivity? I would like you to explain to us what is high gum sensitivity.
Tooth sensitivity is when you get pain from a tooth which has its dentine exposed, and it causes pain when the tooth is exposed to air, to other stimuli like cold, heat, sugary, salty things. When the tooth is exposed because of exposed dentine. And that frequently can be brought about, one, exposed dentine due to excessive brushing, which has caused the gums to recede, exposing the roots of the teeth. You can have the roots of the teeth also exposed due to gum disease, which has been long-term, causing gum recession. You can also have sensitivity of the teeth frequently caused by acidic foods and drinks. When we consume things that are very acidic on a frequent basis, the enamel of the teeth ends up getting dissolved because acid will dissolve the teeth. So there are certain fruits and vegetables that actually promote the dissolution of the enamel. Top of the list, pineapples, mangoes which are not very ripe, lemon. Lemon is very, very acidic. In fact, I think it's the most acidic of the fruits. And during COVID, there was a lot of media coverage about lemon taken with garlic, ginger. All those are also acidic. So a lot of people got the advice that they are defending themselves against COVID using lemon with all different things added to them. And then some people take lemon in their foods. It will also cause the teeth to become sensitive because the constant barrage of acid will dissolve the teeth. And that can be seen clinically when you look at the teeth and they are devoid of enamel on their biting surfaces.
Well, people often talk about dental plaque. What is it?
Dental plaque is basically a creamish substance that becomes attached and accumulates onto the surfaces of the teeth. It's usually composed of salivary proteins plus leftover food in terms of carbohydrate usually, and bacteria. So the bacteria attach themselves onto the surfaces of the teeth. And every time you feed them, they multiply. Have you ever been to an occasion where they've given you a piece of cake and something sweet to drink? And after a while, you take it gently and slowly. You take it slowly. Bite of the cake, bite of the biscuit, bite of drink of soda, sip of the soda. And you continue like that for 30 minutes. And after about 30 minutes, when you pass your tongue across the teeth, they feel rough. Now, that is due to the bacteria rapidly multiplying on the surfaces of the teeth, rapidly multiplying, because they use the sugar in the cakes and in the soda. That energy is used to rapidly multiply, and the bacteria grow on the surfaces of the teeth, and you end up with a thick film of dental plaque. It contains a lot of bacteria and some carbohydrates.
So what's the importance of dental plaque and how does it affect my dental health?
Well, if a lot of it accumulates, I think the first thing, the immediate thing that happens is maybe you can get bad breath. But over a long period of time, two main diseases occur. First, let's talk about gum disease. When plaque accumulates right onto the surfaces of the teeth next to the gums, the bacteria which consume the same foods that we consume metabolize those foods and produce toxins. And those toxins cause the gums to become inflamed and reddened and become hot. And within those toxins, you also have enzymes. And these enzymes dissolve the walls of the blood vessels inside the gums, so that the blood vessels have holes in them. So when you end up brushing your teeth, the blood passes through those holes, and you see that the gums are bleeding. So those are two things, bad breath and gum disease. The plaque is also the same plaque that causes tooth decay. In those bacteria, when they metabolize the sugars, they also produce acids. And those acids are what burn the teeth and produce holes in the teeth. The surface of the enamel, the acid will leach out the mineral in the enamel, and the surface of the enamel becomes rough. And once it becomes rough, it attracts more bacteria because the surface is not smooth. And eventually, the surface of the enamel breaks down to produce a cavity or a hole in the tooth. And then the bacteria grow inside the tooth. And once inside the tooth, they are more difficult to remove because the toothbrush may not reach them. And so with the continual consumption of sugar, the cavity gets larger because the bacteria will continue to produce acid, and the acid dissolves away that hard substance of enamel and dentine, and the cavity gets bigger and bigger. So that's mainly the importance of plaque on our teeth. It causes bad breath, causes gum disease, and it will cause tooth decay. And that's why it's important to remove the plaque every day. As long as you open your mouth, you will introduce bacteria into your mouth. One, by touching or from your fingers. Two, by the things you put in your mouth without realizing it. And just as important, the air we breathe enters our mouth either via the nose or directly from the mouth. The air we breathe contains bacteria. Okay, not all bacteria is bad, but once it accumulates, then there will be shifts in the number of and types of bacteria, and then the bad bacteria will set in and will cause disease.
What is your advice for a person who already has the plaque on their teeth? They still think it's normal for them to have it.
Well, it's important if they have plaque on the teeth to have it removed. Just like one has plaque on the skin, you have to have a shower every day to prevent, again, diseases, especially of the skin. Plaque on the teeth will also eventually cause disease. So it needs to be removed on a daily basis, at least twice a day.
Should I mind if my teeth are yellowish? And actually, what should be the right color for my teeth?
The right color of the teeth could even be a matter of perception. For a young 12-year-old person, the teeth are very light in color. For an 85-year-old man or woman, they're not the same color. They'll be very dark and brown. So one has to fit the color of the teeth in relation to the age of the person. Okay? If you came and you had no teeth at all at the age of 85, and you said you wanted a new set of teeth, I said, fine, but it would be better and for me to give you your new teeth, that color which fits your age. It would make more sense, rather than to give you teeth the color of a 12-year-old. They will obviously look false. So for us in the dental profession, you have to divide between science and art. You have to do dentistry with a touch of art, but on a scientific foundation. So back to the question of what is the right color of the tooth. The teeth, when they are new, are light in color. And with time, there is wear and tear. You see, the tooth has two layers. You have the enamel on the outside and the dentine on the inside. The enamel is light in color, but is translucent. Translucent means that it's like the smoked glass window of a bathroom. Okay? You can tell that there's someone inside wearing a yellow shirt, but you can't tell who it is. Okay? Because it's blurry. So that's enamel. Okay? It's translucent. It allows some light to pass through. Dentine shows up underneath. When the enamel is new, there's a lot of it. It is thick. With wear and tear, and the lemon and pineapples and mangoes people take, the enamel gets thinner and thinner with time. And when that happens, the dentine underneath, which is darker than the enamel, appears to show up more. So the tooth becomes darker with age. I hope that makes sense. Okay? So sometimes the teeth become dark prematurely. And that can happen in a case when people take too much lemon or pineapple, or they eat oranges very frequently, or they drink cola drinks frequently, especially through a straw. And when that splashes across the front teeth, the surfaces of the enamel dissolve away prematurely, rapidly, showing up the dark dentine underneath. So that someone who is 12 years old, who has brown teeth, it's a telltale sign that they're either sucking oranges all the time, or eating pineapples all the time, or drinking cola.
How does smoking and chewing certain things like mirror and then alcohol, how does it affect our oral health in general?
Well, smoking, again, is like a toxin. The smoke itself contains toxins which enter the gums and affect the immune cells of the gums. When they affect the immune cells, the tissues of the gums are less able to fight infection of the gums. So you find that the gums will bleed more easily. The smoke will also stain the plaque to become dark brown or black. That can be easily removed by the dentist. The problem with the smoke, if it stains the lungs, I don't know if it can be reached. So one may maybe decide to stop smoking because of the damage to the lungs, because that can be permanent rather than the damage to the teeth. You come to the dentist, we can get your teeth cleaned for you. But I don't know if the chest surgeon can clean your lungs for you.
Well, as we are wrapping this up, as you're also giving out your last few remarks, kindly advise people out there who are having this thinking of, as long as I am not feeling any pain, I am not supposed to go and visit a dentist.
Whether you're feeling pain in the teeth or not, you need to brush your teeth regularly, gently. Make sure you brush all the sides. Visit the dentist on a regular basis. Be your own dentist first. Be the dentist for your children first. Check on their teeth regularly. Make sure everything is in order. If things are not in order, consult. Check for swellings, redness, bleeding gums, ulcers in your own teeth on a regular basis. Just how you like to check on the engine of a car. You need to check your oil and water regularly so that everything is topped up and clean.
It was really nice having you on the show.
And it's been nice to be back.
Well, like you've all heard, please try to maintain a good oral health. Try to brush every after a meal, or at least twice a day. We've been here at Tony's Dental Clinic in Bakoni, and I personally am coming for a checkup. I remain Kathy Ishine on the Safe Life program. Stay blessed.